Welcome back to the Elite Field and In-Service and Overview. This is part 2. I'm going to go ahead and jump right back into where we left off. Start back up at the top. Most of the information you enter is verbatim with how it was in FieldBridge, so I'm not going to spend much time with each field, but only point out some of the differences you may notice. Some fields in any given template have default values set, such as the PCR number. You can see the default value is set to A, and the select box for number of patients at scene, the default value is set to single. You can certainly change this information, like say if you wanted to add a patient to the incident, change the number of patients at scene from single to multiple, and then the subsequent PCR number change as needed. The next thing I would like to point out is in some fields, like under crew information, when you click the add button and enter the information in, you can see that it completes the entry without you having to do anything further. But like here under the unit information, under other EMS agencies on scene, and you click the add button, and let's say you enter Herman Police Department and it's a law enforcement, then you have to click the OK button to complete the entry. And then you can see this box is displayed in this field. Another thing to note, some information that was auto-populated before in FieldBridge doesn't do that in Elite. Like the unit number versus the unit call sign, we now have to select each one of these individually rather than it automatically populate the unit call sign whenever the unit number is selected. But fortunately, the numbers line up, so it's not a lot of thought process here. Like say 202 lines up with 4362. 201 with 2446, and so forth. They're just mirror images of each other. Over here on the left, the response times. This corresponds with the times over here with the pop-out menu on the right side. So whenever you enter a time over here on this, it enters it here, and vice versa. If you enter it here on the left side, it's going to populate it over here on the right. So you notice whenever you click on one of these date and time entry fields or any alphanumeric data entry field, this menu over here to the left will pop up, and this allows you to enter that information into that field directly from the screen without having to switch between the screen and the keyboard. These numbers over here to the left, -5, -1, +1, +5, this allows you to modify, like say, the minutes incrementally. So let's go down here to the provider actions and procedures just to show you real quick. Like say you click on the date and time the procedure performed. Notice these buttons up here at the top, current, on scene, patient arrival, and destination arrival. If you click on one of these buttons, it's going to populate that time corresponding with whatever time, either the current time, the on scene time, patient arrival time, so forth. That makes it nice so that, like say you're in a procedure, like say a patient assessment, well, you know that's going to be right at the patient arrival time or 1 minute after you got there. Alright, let's close this out. If you go over here to patient assessment and under symptoms impression, you'll notice these drop down boxes, like many of the drop down boxes with large menu items like patient history. It has a drop down box that you can scroll through all the items within that drop down list, or you can type the name or the first few letters and it will pull up what you're looking for, like say if it's chest pain. Just to the right of that is a menu button. When you click on that, it pulls up over here on the left side a menu items within that drop down list as well. Most of these menu items have a categories as the default setting here. I recommend using the ascending order, which pulls up an alphabetized list of all the menu items within that drop down box, and then you can scroll through and select it just like you would if you was using the drop down box. To deselect a choice you've entered, just click on this X button here inside the box and it will take it off there for you. The next button over to the far right of a particular field is a not value selector. This will bring up a list of not values when these choices are more applicable to whatever field you're in. Note that not all fields have the same not values. A big difference from Field Bridge to Elite is a lot of the information available to enter has greatly expanded, like the patient history. It has a drop-down box as well, and you can scroll through, but there's so much information. This is one area I definitely recommend using the menu button and the ascending order. As you can see, the list of patient history is much more extensive than it was in Field Bridge. Since there is a lot more information in some of the lists, like here in patient history, a lot of the items are listed with a category placeholder within the name. You can see that there are multiple types of cancer to select from in patient history, so all types of cancer will be preceded with cancer along with the specific type. Another example is anything related to cardiovascular is preceded by CV within the name. The drop-down menu will still allow you to type in, like say hypertension. Just note that the placeholder CV is there in front of it. It doesn't really mean anything. It's still just hypertension. Under the Narrative tab, over to the top right, from this drop-down box you can select the SOAP format and click Generate to generate a narrative. Unlike in Field Bridge, there are no pop-up questions you have to answer. It just instantly populates certain data into the narrative in a generalized SOAP format. I'm hoping in the future ImageTrend will allow us to change or add some information that it uses to populate the narrative, but for now we will just have to go in and manually add or take away information in the narrative as needed. Like for instance, it says here under the objective heading, at 0910 the patient was found, and then that's all the information it provides. So since this was a cardiac arrest call, we could put in something like the patient was found supine on the floor, pulseless and apneic, or something to that effect. You might have noticed it has an autocorrect feature and it corrects some spelling errors, so let's change this back here to. The remainder of the information seems to populate well into the narrative, with the exception of the transport information down here at the bottom. It gives limited information as to the overall outcome of the patient condition. It omits information pertaining to medical control contact, the room number that the patient was delivered to, and who the verbal report was given to. That information is entered into the report as you entered information over here onto the left side. For now, it doesn't enter that information automatically into the narrative. You certainly can add whatever information you feel necessary down here at the bottom. In addition to this line here about where the patient was transported to, I might add something like the overall outcome of the patient's response and where the patient was delivered to and who the verbal report was given to. If we look up here to the top right and click on this timeline pop-out window, you can see that it generates a chronological timeline of the events in the run report. This gives you a sense of the flow of the call and allows you to see the events and the procedures in reference to each other. This will be helpful in determining if you need to add or modify an event that has been entered. The items within the timeline are color coordinated, with orange indicating a time entry, blue indicating a procedure, green indicates a worksheet has been entered, and anything that is highlighted in red indicates a validation error. You can click on the arrow box to the right of the validation error and it will take you directly to the field within the report. And as you can see, crew member Chris Bruns forgot to put in the units. And we changed it to milligrams. Strong word, Chris. When you click OK, you can see that the validation error goes away. Also note on the right side of any procedures entered, it lists the initials of the crew member who performed the procedure. Up at the top right of the timeline pop-up window, if you click on this tab labeled Patient Encounter Timeline, it opens up an area that gives you a graphical depiction of a specified filter of your patient's previous encounters. In this case, it shows a graph of your patient's blood glucose level depicted over the previous 90 days. You can change the filter to any of the items specified within the drop-down menu. Like say if you wanted to know what their blood pressure or heart rate was trending over a specified amount of time. You can also change the time span of the filter by using the arrow up or arrow down, or just entering in the number of days. Then you can see the graphic spans to include the data over the specified time frame. If you hover over a data entry point indicated by a green dot, it will display the information pertaining to that entry. If you click on the Data tab on the bottom left, it will list the same information in a list type format. Up at the top right, the Worksheets pop-out menu displays a list of worksheets that we can use in place of the STEMI, RSI, and sepsis flow sheets that we have in paper form. The information within a worksheet is consistent with the information on the paper form. It is formatted in a checkoff style list to make it easy to have open and use as you are treating the patient and completing the steps within the worksheet. It is not required that you use the worksheet when you are with the patient. However, it is recommended to start using it as a tool to ensure compliance and thoroughness of patient care. Even if you do not use the worksheet during the patient encounter, there are validation requirements that will direct you to a worksheet during the completion of your PCR if it is applicable to the nature of call. For now, the STEMI, RSI, and sepsis flow sheets are the only three that we have available as worksheets. We may add more worksheets later for the LTV vent flow sheets, but for now, the format of the worksheets limits what information you can place in them and makes this impractical for the time being. Also note that once you complete a worksheet, the only way to go back into that particular worksheet you completed is to open the timeline pop-out window and click the arrow box next to the worksheet entry. It will open it back up and then you can edit or complete the worksheet as needed. The Power Tools over on the right side allows you to quickly enter information into the report pertaining to that particular Power Tool you are using. The information within a Power Tool is the same information that can be entered into the report from the tabs over here on the left side. The exception to this is the Labs Power Tool. Since this is a 911 scene response, there is no reason to enter labs into the report, but if this PCR was an inter-facility transfer, as you can see, Labs is listed here as a sub-tab under the Patient Assessment tab. To enter a lab result, you would click the Add button and the Add button under the Lab Results grid. And this will open up an area with the drop-down menu of all the various labs. Then you can enter the lab result here below. You can see this would be fairly labor intensive to enter all the labs individually. So if you click on the Labs Power Tool, it pulls up a page with the most common labs given for the chemistry panel and the complete blood panel, or CBC. And you can enter them here into the report fairly quickly, and it displays them in this fishbone format. I would like to see a cardiac panel placed in the Labs Power Tool, but for now I don't have any control over what Image Trend does. I will certainly suggest that to them. In addition to the labs entered into this area, if there are other labs you want to enter, like say a lactate level or troponin, you can enter it as an individual lab over here on the left side. This concludes part 2. Please continue on to part 3.